Hello and welcome to Karen's Medical Corner. I'm Karen O'Day. I'm a family nurse practitioner and a nurse midwife, starting this podcast to help individuals in the community understand healthcare, what's available for their healthcare needs, as well as give them an understanding of medical related conditions. This will include talking about health promotion, disease prevention, as well as chronic illnesses, and answering individuals' questions. I am highly motivated to answer all questions and to have any suggestions on topics that you would like to have discussed. I want to start the podcast by giving some information on myself. Again, my name is Karen O'Day. I was born and raised in New Mexico, graduated from Farmington High School, and have my associate's degree in nursing from New Mexico State University, my bachelor's of science in nursing from St. Joseph's College in Standish, Maine, and then my graduate degrees for nurse midwifery and family nurse practitioner from the University of New Mexico. I also have a business degree, a master's in business administration with an emphasis on hospitality and tourism, and completed the didactic portion of medical school through the International University of the Health Sciences. I currently own and am the practitioner at EverCare Family Practice. EverCare Family Practice has been established since 2017 and provides full services of family practice care to individuals ranging from birth through geriatrics. We also provide aesthetic services as well as an extensive program on hormone replacement therapy. It's my pleasure to bring this podcast. I have been looking forward to doing this for quite some time, as there are so many questions I get asked on a daily basis from individuals and patients that could and need to be easily accessible and repeatable for them to look up at any given time. We're going to be discussing a wide range of topics. Today's topic we're going to talk about is accessing healthcare. And this is very important for individuals because many of them don't know how to go about or where to go to access health care. For patients who have insurance, many times they can call their insurance company and get a list of providers who are available in their network and call and make an appointment. For individuals without insurance, that can be a little bit more difficult for them. I find that most of my patients tell me that they do Google searches as well as look in their insurance or directories for information on providers, and then we'll also get information via word of mouth from friends and family members. There are a large modality range for providing health care for individuals. There are public health departments, there are large community service programs, and then there are individual practices. The individual practice seems to be more and more eliminated as the large corporations buy up practices and hire providers as employees. To me, this is very sad as well as concerning, because in these models of care, many providers are overworked. There's not enough providers to go around. They're seeing patients as quickly as possible, trying to provide the best health care that they can with a limited amount of time. I find for myself that the best mode of practice has always been to be in private practice. Up until January of this year, we were taking the insurances, and again, we're being inundated with patients due to healthcare shortages in New Mexico. In January of 2023, we decided to make an unprecedented change and do a model of care that is becoming very popular across the United States, and that is called Concierge Medicine services. Many people don't know what Concierge Medicine services are, so I did want to discuss that today to try to clarify what is a Concierge Medicine practice. Concierge Medicine is something that a lot of people equate to old-fashioned type of medical care, where the patient has sole access to one provider. They have access on a 24/7 basis. They can call that provider's office and talk to the provider on the phone, not having to wait on hold or waiting for a receptionist to give a message to the provider and then waiting for a message to come back from either a medical assistant or from the receptionist. Our practice has dedicated itself to providing that personalized approach of care. We are currently limiting our practice to 300 family practice patients who want the concierge full service, and then we have a modified concierge service that is available to 350 individuals, which consists of physical exam and follow-up visit, as well as any and all referrals and doing refill prescriptions for a year. This program serves people who really only want to see a healthcare provider or need to see a healthcare provider once a year. The physical exam for our healthcare approach of concierge is a 90-minute visit. This includes the head-to-toe physical, as well as hospital-grade EKG and ankle brachial indexes. At the time of the visit, blood work is ordered and is included in the fee, as well as any and all referrals such as mammogram, bone density scan, gastroenterology referrals for colonoscopy, any and all specialty referrals that might be needed, and doing refill prescriptions for a year. The second part of this visit includes the follow-up visit, which is a 60-minute long visit. It is to go over all the lab results, follow up on all the referrals, go over results from imaging, and to answer all questions and to ensure that the patient has had all of their refills done and that they have no other additional questions or concerns. The full concierge service is more for people who are looking for a provider to be accessible to them 24/7. This usually includes people who have more chronic health conditions, who are seeing a provider more frequently and are tired of seeing a different provider at every visit for 5 to 10 minutes a visit, unable to get all of their questions answered and feel like they're being run through a cattle chute. That's been the case for years, and I could no longer work from 7 in the morning until 10 o'clock at night to try and provide for 2,000 patients that accessible care, which was impossible in the growing number of patients in our practice. So for that reason, at this time, we've again gone to concierge medicine. So people always ask me, well, with concierge medicine, do I need to keep my health insurance? Well, most certainly you need to keep your health insurance, because concierge medicine is not a replacement for your medical insurance. Concierge medicine is a concept that provides services that your insurance does not pay for. For example, your insurance company could care less if it takes you 6 months to get in to see a provider. They don't care if it takes you 2 weeks to get a refill, or if you're waiting to get a call back from your provider for 3 or 4 weeks, or you don't get a call back at all. Your insurance doesn't care if it takes you 3 or 4 weeks to get a follow-up appointment to go over your labs. Your insurance does not pay for home visits, and your insurance could not care less if your family practice provider goes to the hospital and advocates for you if you're in a situation where you have to be hospitalized. The insurances also don't care how many times you go to urgent care or how many times you go to the emergency room. Concierge medicine works to keep their patients out of urgent care, out of the emergency room, by providing complete continuity of care for those patients that are in the practice. So for concierge medicine, our office is able to offer same-day appointments or next-day appointments. My patients can reach me 24/7, 365 days a year. If it's Christmas Eve at 2 o'clock in the morning and somebody needs to get a hold of me, they can call me on the phone and access me personally. They are never going to talk to someone who is on a call service, who knows nothing about them, and who is reading generalized information off of a card to tell them to go to urgent care or the emergency room, or give them generic information on what to do to treat their symptoms. It is one-on-one personalized approach, knowing the patients, their background, their complete medical history in detail. That's the concept of concierge services. If somebody's too sick or does not wish to come to the office, we can make home visits, and I do make home visits on a regular basis. Email is available, so patients have a wide variety of ways to contact me. They can contact me through text, they can contact me through email, they can contact me via phone, we can do telehealth visits, we can do office visits, and they can contact me at the office phone number. This is so important for a patient to know that they're actually going to be able to talk to their healthcare provider and not be on hold for 45 minutes, not get a phone call back, and be hanging and wondering what to do when they have concerns, questions, or are having anxiety about something that's going on with their health care. This is an approach that people used to have as generalized practitioners 40, 50, 60 years ago with the family docs who knew all of their patients, who did make house calls. But our system is in such a disarray and disorganized right now, and putting so much pressure on the providers that they can't possibly practice that situation without doing a limitation to the practice. And people say, well, why charge a membership fee? Well, if I only have 300 patients in my practice, I can't survive and pay my bills and stay in business without charging a membership fee. This membership fee is what the concierge service is all about. Now, our practice has chosen to stop taking all insurances due to the very poor reimbursement rate, which was being decreased as of January across the board by almost all insurance companies. We have continued to take Medicare, and that does include Medicare supplements. For our patients with Medicare, they will never receive a bill. They come into the office, their office visit is billed to Medicare, and they know completely what their bill is going to be before, during, and after the visit, which is nothing. Their fee merely includes the membership fee, which again, this membership fee is not for healthcare services that are covered by insurance companies. That's where the confusion seems to lie, is that people think that if I have the membership, why do I have to pay for a visit? In order to stay compliant with federal laws, anytime somebody comes into the office, we must bill them for an office visit, something that whether they have insurance or not would be paid for if they did have insurance. The membership fee is not for the healthcare visit. It is for having the specialty access to the provider. And I think that's the most important thing that people need to understand. It is for this specialty service of 24/7 access to the provider and having specialty care where you're receiving your results same day as they arrive, where you are receiving phone calls directly from the provider, talking directly to your provider anytime you need me. That's what that service is for. I've had several patients who have told me, well, that's just for the rich. Contrary to that statement, it is actually not for the rich. I tell people all the time, people will pay for what's important to them. And I like to quote a phrase I heard from Doc McGee while on a KISS cruise back in October of 2022. And that is the phrase that he coined, which is called quality time remaining. Everyone in life has their own individual quality time remaining specifics. Some people's quality time remaining is eating out at fancy restaurants. That's important to them, and they should do that. Some people's quality time remaining is traveling. They should be doing that. Quality time remaining should be enjoying your life and doing what you need to have a good life. And so if somebody's emphasis regarding quality time remaining is on healthcare, their healthcare, then this membership is perfect for them. And I honestly believe that everybody's top priority should be on their health care, because without your health, you have nothing. If you don't have good health, you can't travel. You can't go out and eat at nice restaurants. You can't go mountain climbing. You can't go skiing. You can't enjoy your grandkids or your children. You're unable to do anything. You can't make an adequate living. If you don't have your health care, it leads to an array of disorders, depression, anxiety. All sorts of mental health issues arise from chronic health conditions. But it's that individual's own priority that sets their determination for what is worth their quality time remaining. So when you're paying for a membership, as for at our office, if you pay in a yearly amount, it's $4,333. And sometimes people will gasp at that. And I tell them, if you pay for it on a yearly basis, even if you pay it out monthly or quarterly, you're looking at anywhere from about a little over $8 a day to about $11.99 a day. And when you think about what people are buying, that is basically a coffee and a meal at any of these specialty coffee shops, and it's much less than a meal that you would have if you were eating out. My husband and I ate out last night, and it basically cost a fifth of what a monthly payment would cost. And we were shocked at the cost of eating out. I have one patient who actually wanted to join our membership, and she disclosed to me that she was eating at McDonald's twice a day. She was eating there on her way to work to get breakfast, and then she was picking up supper on her way home at night. And she said, I've decided that my health is what's important for my quality time remaining. I want to be as healthy as possible. So I'm giving up McDonald's and I want to join your membership. That's what the membership is all about. It is not for just the rich. It is for people who have an inspiration to and realize that your health is the most important thing in your life. I don't push the membership. I want people to be on the membership who value their health and need that health care. And like I said, not everybody wants that. Many people seem to be fine with seeing a different provider every time they go to their health care clinic, or having a 5-minute visit or a 10-minute visit. And if that is something that makes them happy, then they should certainly do it. My philosophy on life is that people should be free to make their own choices regarding anything in their life that affects their quality time remaining and affects their life in general. I tell patients all the time, I will advocate for whatever you choose to do. It is not my choice, it's your choice. And individuals should have choice regarding all aspects of their health care, no matter what that is. You can't tell people, I will have you make a choice in this aspect of your health care, but you must do something else with this other part of your health care. That's hypocritical, and that's not freedom of patient choice. We have to, I feel, support our patients in every aspect of their life to make their own medical decisions with informed and properly educated information given to them by their healthcare providers. They should be educated to know what is a good decision, what may be a bad decision, and then they determine. And maybe they make a bad decision. There's consequences to every decision. Some are good consequences and some are bad. And whichever healthcare choices we make, we have to own up to making those decisions. But the point is, people have to have the information. And I wanted to give the information on what concierge medicine is, to dismiss all the myths that are out there, to get rid of the stigma that it's only for the rich. Because frankly, most of my patients who are doing concierge medicine are not rich. They are average American citizens who place a large, huge, most important part of their life in maintaining their health. They want to be healthy. They want to live as long as possible doing what they want to do, being free of illness. And that's what we strive for, and that is what's able to be given in a personalized way doing concierge services. So it is my pleasure to do those services. It's my pleasure to take care of all of my patients. This is something that I absolutely love to do. And so that's what our practice has gone to. I feel like it is just a better form of healthcare. It decreases the patient population that I'm able to see, but for those patients who choose to do that, it gives them the best healthcare that is absolutely available to them. And that's what I want to do. I have to sleep at night, and I sleep really well at night knowing that I'm giving these individuals the best health care that they can possibly have. As far as the other aspects of our practice, obviously our aesthetics practice and our hormone replacement therapy is not part of the concierge service, because for bioidentical hormone replacement, most insurances don't pay for that anyway, and certainly for any aesthetic services, insurance companies are not going to pay for that, so membership is not required. My concierge services are only for family practice. And this approach has seemed to be working really well. It's decreasing my stress level and my burnout level, and it's giving patients the confidence that they know they can call, and if they need something, if something is going on in their life, they are not left out in the cold not knowing what to do. So I wanted to start this podcast with that type of presentation, the excitement that there is in knowing that you have healthcare options available to you. You don't have to wait in line. You don't have to hope that you get to see your same provider for a second visit. You don't have to hope that you get more than 5 minutes. You don't have to go into an office and talk as fast as possible, rattling off questions to your healthcare provider that can't possibly answer them all because you know you've got about 5 to 7 minutes with that person. And so this, to me, is the way healthcare should be. Like I said, it's not for anyone, every single one. It's just for people who want that approach to healthcare. And everybody should have their choice on what they determine is important to them. And so I wish everybody happy health, a long, happy life, and absolute happiness in whatever you decide to do. We're going to be doing another podcast. It will be published shortly, and we're going to be talking about healthcare professionals and how patients should be treated with dignity, respect, and as individuals. Thank you so much for joining us in our first podcast, and I really appreciate you all being here, and I look forward to any and all questions. You can email me at evercarefamilypractice@gmail.com. You can call me at 505-780-8301 with questions, or you can text that number as well. You can also go to our Facebook page, which is also EverCare Family Practice. And you can go to our website at www.evercarefamilypractice.com. I look forward to hearing from you, and I look forward to your input, any type of questions that you have, and any topics that you would like to have discussed. Thank you so much again for joining us. It's been a pleasure.